I'm Allie Gass,
I'm Cameron Crivelli.
and we did our research study on the impact of mental health diagnosis and medication use on sleep in collegiate athletes.
For some background information, sleep serves many important regulatory functions in mental health, and mental health conditions such as anxiety and depression often have a significant impact on sleep. Regular physical activity has been shown to reduce symptoms related to mental health conditions. However, these benefits are not always balanced with the additional stressors associated with collegiate athletics. Mental health conditions are commonly treated pharmacologically, with an estimated 17% of U.S. college students having been prescribed a medication such as a selective serotonin reuptake inhibitor for a mental health issue. The purpose of our study was to examine sleep differences between collegiate athletes with and without mental health diagnosis, and to determine if medication use influenced sleep amongst those with a mental health diagnosis.
For the methods for this study, our study design was a cross-sectional 10 to 15 minute survey, which we did on 566 collegiate athletes from 2 NCAA Division I institutions. Our survey instrument gathered demographic information as well as mental health history questions, which included, have you ever been diagnosed with a mental health condition? Yes or no? And if yes, do you take prescription medication for your mental health condition? Yes or no? We also used the Pittsburgh Sleep Quality Index, which gave us some global score from 0 to 21, greater than 5 indicating poor sleep clinical cutoffs, and then 7 subcomponent scores, which included sleep quality, latency, duration, efficiency, disturbances, sleep medication use, and daytime dysfunction, all on a 0 to 3 score range. Our procedures were captured during the electronically pre-participation physical exams and athletic training clinics or during team meetings between August and September. For our statistical analysis, we performed independent t-tests to compare the PSQI scores between those with and without mental health diagnosis to assess the relationship between sleep and mental health and the impact of medication on sleep. Going into our results, 2 of our major findings were that collegiate athletes with a mental health diagnosis had significantly worse global and subcomponent sleep outcomes compared to those without a diagnosed mental health condition, and that those taking medication for a mental health diagnosis demonstrated worse subcomponent sleep scores for sleep medication use and daytime dysfunction.
The mean global sleep score of our sample of collegiate athletes with a history of diagnosed mental health condition was above the PSQI clinical cutoff score indicating poor sleep, while their counterparts without a mental health condition fell below this threshold. Further, the use of mental health medications may magnify these negative sleep outcomes, particularly as it relates to sleep medication use and daytime dysfunction. Selective serotonin reuptake inhibitors and other mental health medications are known to cause increases in energy levels and decreases in REM sleep, which could explain these findings. The clinical relevance of our research is clinicians should proactively monitor collegiate athletes' mental health and sleep habits, and address concerns using sleep hygiene, counseling, and education.